Hello, my name is Dr. Cheryl Burdette, and I'm the Educational Director for Origins Incubator. And if there's one thing that we're constantly explaining to patients, it's the importance of nutrition and especially magnesium. It's so nice to see something hypersensitive like this in terms of really explaining that mechanism of action, in terms of how stress requires us to utilize more magnesium and then also causes us to lose more magnesium, really demonstrating that this is something that it's important to support our patients with. So in our clinical classroom today, we looked at some of these mechanisms. We shared some graphs to make for easy patient handouts. And so talked about how, for example, once we are in a more excited state, what happens is our magnesium moves from an intercellular space to an extracellular space to calm down neurons. And this is what leads to more urinary excretion. But unfortunately, and we're in this excited state, we end up needing more magnesium. It's the same thing that causes us to lose more magnesium. And not only does it impact our ability to calm down excitatory neuronal expression, but that magnesium deficiency decreases your serotonin receptors. It decreases your GABA receptors. It increases NMDA receptors, which make us ache. And again, as we look at the stress response, more epinephrine, more norepinephrine, more cortisol, that begins to deplete resources. And so when we have symptoms, fatigue, irritability, anxiety, headaches, even an upset stomach, we can think about these in terms of magnesium deficiency and help our patients to recognize this vicious cycle in terms of what happens. And so how it's important to make sure we're supplementing, especially when we're under increased times of stress.